In this module, we are going to look at how we review the patient's progress on the action plan and change plan. When we meet the patient for the second session, after having set the agenda, we need to review the progress on the plans that we had agreed on in the first session. We will see that one of three things might have happened with regards to progress made. One, it's possible that the patient has not followed anything in the plan that we agreed. Two, we might find that the patient has followed some things, but not all, in the plan that we agreed on. And three, the patient might have followed all the things that we had agreed on in the plan that we made in the first session. The way we deal with the three situations differs. So, if the patient has not followed anything, we have to find out the reasons for that. The two common reasons for this happening are that the patient does not have enough motivation to follow up on the plan. And if this happens, we have to continue doing the motivational development work that we have been doing in the first session. Another reason for the patient not having followed the plan is that the patient does not have the skills to implement the plan. If we find that this is the case, then we have to focus on discussing and finding out what the problem areas are and what the skills the patient requires to implement the change plan. Some of the common problem areas that patients will come up with, which prevent them from implementing the change plan, are detailed here. Next to these problem areas, we have listed the skills that they would require to manage these problem areas. So, for example, if a patient has not been able to stop his drinking or control his drinking because he has difficulty in saying no to friends who force him to drink, we need to focus on building up his skills to refuse a drink when friends force him. Another type of patient would be the one who has followed some of the things in the plan, but not all of them. The first thing that we need to do for such patients is to congratulate them for being able to do some of the things that they agreed on. Then we go on to encourage them to talk about the changes that they have made. Finally, we discuss the areas that they found difficult to implement, explore the reasons why they found them difficult to implement, and then work out with them how they could manage these difficulties in the future. And then there will be the patient who has been able to follow all the things that we planned for. In this case, we have to congratulate the patient and ask them to elaborate on the efforts it took to achieve these goals. We need to discuss possible difficulty areas, if any. We also need to discuss any specific skills that the patient might want to work on, example, drink refusal skills or problem solving. And if there are no challenging areas, we can move on to phase 3 of the CAP counseling process.